know this is a controversial topic, and it's one you know a lot about, have a lot of experience on the topic. So first of all, we'd like you to define, if you will, your definition of recovery.
Sure. Well, and again, mine's going to come a little bit more from the scientific and more of the, professional viewpoint. But I do think that, the word recovery or what is considered recovery is subjective to some extent based on, each family's priorities, expectations of their child. But our definition of recovery is that, the child's is now, their function, their current levels of functioning fall within all, normal ranges based on scientific and standardized testing, right? So there are IQ tests, there are speech tests, adaptive language or adaptive functioning tests, behaviors, those types of things. Also, that they no longer fit the symptomatology for the diagnosis of autism. So their, behaviors are now consistent with typical developing peers. Their, socialization, their ability to socialize and manage is falling within normal ranges, and they no longer fit the criteria or the scientific criteria for autism. So now you have not only they no longer fit the diagnostic criteria, they also now are functioning and being able to be tested within standardized ranges.
And so, Vince, I guess the biggest first question, because a lot of people just don't believe in recovery, but there are multiple, we're in the hundreds now of studies that show that can happen, correct?
Absolutely. And we know, here at CARD, we've had hundreds, if not more, kids that have recovered from autism, based on the amount of treatment and the amount of work and the amount of effort, that they've gone through, that they no longer have the diagnosis of autism. So they're developing, or their current level of functioning is within all typical norms, and they're living their lives as typical teenagers, young adults, and so forth.
And so, Vince, let's talk about your personal experience in this.
Sure.
So in your personal experience, you have worked with children that have fit this definition of recovery.
Correct. I've had several kids. On the top of my head, I'm going to say 5 or 6 kids that I've worked directly with, maybe even more than that have been, classified as recovered. Now, I think sometimes the confusion comes up with the word recovered versus the word cured, right? Recovered is different than the word cured. What we're looking at recovery is that they've met their goals, that they're functioning, independently. They've removed the symptomatology for the diagnosis of autism, and they're successful. I have, kids that I worked with that are, successfully have graduated from college, that are now maintaining full-time jobs, that are in, active relationships with intimate relationships with boyfriends, girlfriends, that kind of thing. That they have peer groups. They're volunteering across the world, doing different types of jobs to help others. A lot of just fantastic stories with kids that were classically diagnosed as autism. We're not talking the ones that just barely made it or the ones that were. So we're talking all across the spectrum. Kids have recovered and they've been able to lead successful lives.
So let's go back and look at what were the ingredients that went into that recovery, because when when I first heard about ABA, my child was already 4. By the time I was able to obtain ABA for him, which was 30 hours a week, he was almost 5. Okay. So on the one hand, I was extremely hopeful and was even told by a few experts he'll recover.
Right.
On the other hand, I'm seeing this window, and I'm seeing this window rapidly closing down, and I'm kicking myself that I didn't get him this therapy when he was 2. Of course, I had no way. I didn't even know about it. Nobody mentioned it to me. So what were the elements in these children that you worked with? How old were they when they got ABA? How extensive was it? And is that, in your opinion, a requirement for recovery?
I don't know if it's a requirement, but I definitely, all the research does point to the earlier the intervention starts, the better chances of positive, successful or treatment success that the kids are going to get. But as with anything else in our world, right, there's no guarantee. I've had kids that have started it too and have worked hard and, depending on their level of impairment, have succeeded and done really well, but they wouldn't have met that criteria of recovered. We've had kids that have started at 5, 6 years old that have, you would ask, what does it take to get to recovery? I mean, the first thing that came to my mind was blood, sweat, and tears, right? It's as, working as hard as they can. The family's working as hard as they can to get the kids. And we've had, kids that have, like I said, have come in at a later age that have recovered. We've had kids that have come in at a later age that have not. It really depends on a lot of different variables, some of which we have control over, like the amount of treatment and the types of treatment and curriculums and stuff we're presenting. But a lot of it has things that we don't have control over, medical issues, level of impairment, other types of maybe family dynamics that are involved.
So what
Those
level
types of variables sometimes play into their ability to recover or not recover.
Okay. And I'm sorry to interrupt you, but just to clarify then, how many hours a week, and I know we can't set this in stone,
right,
but in general, at what age do you recommend that they start intensive ABA, and how many hours a week do you recommend?
Well, again, hours of recommendation can only be done individually, right? We have to look at each individual child and their dynamics, impairment, and so forth. However, going back to what you were saying, when should early intense intervention start? And I think that's a great way of phrasing it, because that gives a little bit better of a definition of the type of therapy, is as early as possible, right? The quicker we're able to get in there and intensely work on these behaviors, shape the behaviors, change the behaviors, learn new neural pathways so that they can do things differently, they can learn in different ways. The earlier we can start working on this in an intense model, the better.